One of the most common pieces of advice that the internship team gives to preceptors is to use the KPIs and call it like you see it. But we recognize that this isn't always as simple as it sounds. So let's break it down. First of all, using the KPIs is an essential part of evaluation. The KPIs are the approved standard for entry to practice in dietetics at the competent level. Let's use a sports metaphor here. Pretend that a friend invites you to play on their baseball team. You've never played baseball before. You've read the rules, watched a few games, and understand how it is supposed to be played, but you've never done it yourself. That's kind of what it is like for interns at the start of their internship. They have knowledge, but they haven't translated the knowledge into skills. When you first start going to baseball practice, you learn how to hold the bat, how to swing, how to hit the ball. You practice catching the ball. You practice running and getting to the bases faster. That's what internship is like, learning how to do things and actually doing them for the first time. At first, you aren't very good at baseball. You strike out, you fumble a catch, you don't make it to the base in time, but you try and you are improving. This is kind of what the novice level is like for interns. It is just the start. You keep going to practice and you get better. You make some good hits. You catch and throw swiftly. You still sometimes strike out. You're maybe a little inconsistent, but you're building skills. This is kind of what it is like to be an advanced beginner. Interns at an advanced beginner level are developing the skills but lack consistency and still need some preceptor support. The more you practice, the better you are at baseball. You develop some reliability and consistency in your skills. The team can count on you to play your position and to run fast. You're a competent baseball player. No, you're not hitting home runs. No, you're not going to get picked up for a professional baseball team. You're not an expert. You haven't been doing this for years, but you can play and you can mostly play well. That's what it is like for the competent interns. Competent interns aren't going to show the same level of expertise as their preceptor, but they're showing some consistency and reliability in their skill level. They can practice reliably and safely. I hope that baseball analogy helps to explain a bit about the progression of skills. Some general tips about using the KPIs. Don't treat the bullet points in the KPIs as a checklist. Do use the bullet points as a comparative descriptor which describe a variety of behaviors for each competency. A student doesn't have to hit every bullet point in the KPI to achieve competency, as some bullet points might not be relevant. Don't score novice or advanced beginner solely because the intern is early on in their internship or their placement rotations. Do use the KPIs to compare the observed behavior and score what you actually saw them perform. Interns can be competent in a skill in a specific practice area, even if it is early on in their internship. Don't score skills you didn't see or only saw once, where you don't know if the intern is consistent and reliable at performing that skill. Do use the unable to assess score, which is used when there was not adequate opportunity to assess the skill. Let's go through an example to illustrate the use of the KPIs. Let's meet Penny and Justine. Justine is an outpatient dietitian, and Penny is her intern. This is Penny's first advanced clinical rotation. She's had 4 weeks of intro to clinical and has just completed 4 weeks with Justine. It is 2 days before the end of placement, and Justine is working on Penny's evaluation and is unsure how to score 2 competencies. C7, develop nutrition care plans, and P8, manages time and workload effectively for the area or place an internship. Example, just starting, middle, or end of placements. Adapts to change in the practice setting. Justine reviews her notes on Penny's behavior and actions. Week 1. Penny mostly observed and saw appointments for education and counseling for increasing protein and fiber intake and carbohydrate sources for a patient with type 2 diabetes. Week 2. Penny participated in appointments. By the end of the week, she was leading the assessment part of the appointment and handing over the education and counseling part to Justine. Penny began charting on 1 to 2 of the visits each day. Week 3. Penny continued leading the start of the appointment and started doing some education and counseling when patients were there to discuss protein, fiber, and carbohydrates. Penny was mostly able to manage the time for each appointment with a few nudges from Justine to move to the next section so that the appointment wouldn't run late. Penny was able to recognize what type of information was needed by most of the patients. Penny became flustered when a patient asked about something unexpected. Penny gave an inappropriate or incorrect recommendation for a patient, and Justine had to jump in with a correction. For a different patient, Justine asked Penny to be prepared to discuss additional strategies for managing constipation in a follow-up visit with the patient, and gave Penny time to prepare. During the visit, Penny made suggestions that the patient had already tried before, and ran out of suggestions, indicating that she had not adequately prepared for the visit. This week, Justine suggested that Penny chart on 3 to 4 patients per day, but on 2 of the days, Penny had to stay 15 minutes late to get the final note done. Week 4. In the last 3 days, Penny has continued doing the majority of the patient visits. She successfully managed the time and flow of each appointment with little prompting. Appointments started and ended on time. This week, when a patient asked her something unexpected, she professionally pivoted to asking Justine, and Justine was able to chime in, making the transition seamless between Penny and Justine. Penny continued to make appropriate suggestions about protein, fiber, and carbohydrates. Justine asked Penny to prepare for a visit with a focus on managing diarrhea, something Penny had not seen before. Penny pulled appropriate resources and set appropriate goals with the patient. Justine had to jump in once with one additional recommendation that Penny had missed in discussing with the client. Penny charted on 4 patients every day this week and stayed 5 minutes late once. Let's look at the competencies one at a time, starting with C7, Develop Nutrition Care Plans. This competency is all about identifying the goals for nutrition interventions and using critical thinking to select targets or goals. Let's see where in Justine's notes does she mention that Penny has been doing this skill. We can highlight that in blue. In week 3, Penny was able to recognize what type of information was needed by most of the patients. Penny gave an inappropriate or incorrect recommendation for a patient. Penny made suggestions that the patient had already tried before and ran out of suggestions. And in week 4, Penny continued to make appropriate suggestions about protein, fiber, and carbohydrates. Penny pulled appropriate resources and set appropriate goals with the patient. Justine had to jump in once with one additional recommendation that Penny had missed in discussing with the client. We can see that Penny is making some appropriate interventions independently. Let's look at the KPIs for Advanced Beginner and Competent, and then decide what score to give. A competent intern uses guidelines and similar experiences to plan the nutrition prescription or overall targets or goals for the client, as well as develop plans for client support. A competent intern uses guidelines and similar experiences to consider the options and identify the goal for nutrition intervention. At an advanced beginner level, the intern is just beginning to use similar experiences and guidelines to make nutrition interventions. For this bullet point, Penny is leaning towards competent so far because she's been making suggestions on protein, fiber, and carbohydrates this week, which are based on guidelines and her experiences in previous weeks. We should look at the rest of the bullet points to ensure consistency before we decide. The next bullet point says, uses critical thinking to select and plan the nutrition prescription or targets and identify goals for nutrition interventions. At an advanced beginner level, the intern selects appropriate information and its relevance to the situation successfully with moderate supervision. Penny was able to think about which resources and recommendations would fit for the patient with diarrhea, even though she hadn't seen a patient for this symptom before. I would consider this competent for selecting interventions. The next bullet point is that the intern needs to put the nutrition prescription or target into the overall picture of the client's needs. This is something that Justine's notes don't really specify. Similarly, the next bullet point is plans and accurately calculates nutrition support regimens. This wasn't relevant to this placement, and that's okay because this is not a checklist. The last bullet point is about the level of supervision required. In week 3, Penny certainly still needed moderate supervision because she was making mistakes. In week 4, Penny is not needing as close of supervision, showing overall growth. Yes, Justine had to jump in once when Penny missed something, but that was on a topic that was new to Penny. Penny has been consistently able to make appropriate recommendations on topics she's familiar with, And so for this reason, Justine will give Penny a score of competent for C7. Now let's look at the KPIs for the professional practice competencies. P8 manages time and workload effectively for the area and or place in internship. Example, just starting, middle or end of placements. Adapts to changes in the practice setting. Let's highlight Justine's notes on this topic in purple. Penny began charting on 1 to 2 of the visits per day. In week 3, Penny was mostly able to manage the time for each appointment, with a few nudges from Justine to move to the next section so that the appointment wouldn't run late, indicating she had not been adequately prepared for the visit. This week, Justine suggested that Penny chart on 3 to 4 patients per day, but on 2 of the days, Penny had to stay 15 minutes late to get the final note done. In week 4, Penny has continued doing the majority of the patient visits. She successfully managed the time and flow of each appointment with little prompting. Appointments started and ended on time. Penny charted on 4 patients every day this week and stayed 5 minutes late once. We can see from these notes that Penny had some difficulty with time management. Once it impacted her ability to be prepared for a patient visit. A few times it impacted her and her preceptor's ability to leave work on time. However, she has managed the appointment time fairly well. Let's look at all the bullet points for competent. Consistently considers the impact of his or her time and workload management on others. Able to prioritize and manage competing priorities. Uses a variety of tools and strategies to support time management. Able to develop work plans, set personal deadlines, and employ other time management strategies. Consistently able to estimate the time required to complete workload volume. Works independently but verifies actions with the preceptor. We can see that Penny has improved in this skill from week 3 to week 4, but is it enough to be considered consistently? She still had to stay late once, so she's not finishing her work consistently on time. But it was only 5 minutes and not 15 minutes, which is a big improvement from the previous week. She's also improved on her time management in appointments and has done really well at managing the flow of appointments so that appointments started and ended on time. Is Penny truly competent in this or not? Having to stay late once for 5 minutes isn't such a big deal. It happens to all of us sometimes. But let's read the bullet points for advanced beginner and see if this resonates with us more or less than the description for competent. Aware of how time and workload management impacts others, beginning to prioritize competing tasks or activities, beginning to draw on previous experiences and exposure to develop work plans, self-directed deadlines and other time management strategies, generally able to estimate the volume of work that can be completed in an allotted time period, requires moderate supervision and guidance to effectively manage workload. What do you think? I think you can make the argument for advanced beginner, given her inconsistency with getting her charting done on time, and that would be fine. I also think you can make the argument for competent, because she has become a lot more consistent in the past week, and she has done well with the time management in other aspects besides charting. I personally think I would give a score of competent for this one. I hope this illustrates how the KPIs help to guide you in making objective decisions, but that ultimately there will be some subjectivity. This is where it's really important to include comments on your evaluation to justify your decision. If you chose to give an advanced beginner score, it would be important to describe that the reason for the advanced beginner score is due to Penny's inconsistency with finishing her charting on time and her requirement of staying late multiple times during this placement. If you choose to give Penny competent, you would commend her for being consistent in completing the appointment on time, but still note that she needs to work on her charting efficiency. Either way would be appropriate, but having those comments to help justify your scoring would be very important for the intern and the internship coordinator in understanding your evaluation. If you still feel uncertain or stuck after reviewing the KPIs and considering the behavior you observed, you can always reach out to the student's dietetic internship coordinator at the university. The role of the internship coordinator is to support students and preceptors through the internship process. We'd be happy to hear from you and help you work through in deciding a score. I would also ask that you please avoid discussing performance information with other dietitians, as intern performance should be kept confidential. The one exception to this is if you and a colleague are co-precepting and completing the placement and evaluation together. In that case, you will need to work together on your evaluation and come to an agreement where you can both sign off on it. Thank you so much for joining me for this Preceptor Skill Snack.